Our third speaker is Monique Anthony. Monique serves as the Director of the Office of Minority Health and Disparities Elimination at the Tennessee Department of Health. Monique graduated from Spelman College in Atlanta, Georgia, with a Bachelor's of Science in Biology. She earned her master's degree in public health with a concentration in community health and a graduate certificate in epidemiology at East Tennessee State University in Johnson City. In her role at the Department of Health, Monique facilitates and advocates for the development of policies, programs, and services that appropriately respond to population health disparity issues across the state of Tennessee, specifically those of racial and ethnic minority populations. She has led community-based outreach and assessment activities regarding breast cancer, influenza immunizations, and maternal and child health. Thank you for speaking with us today, Monique.
Monique, you are on mute.
Can you hear me now?
There we go. Now we can hear you.
Okay. Okay, thank you. Good morning, everybody, and happy Saturday. Thank you, Jacqueline, Claire, and the Tennessee Healthcare Campaign for inviting me to here this morning. I truly appreciate the context that Jacqueline and Kanika brought to the conversation relative to health disparities and health inequities. Thank you so much, ladies. You all truly set the stage for me to just really share the work that we've been doing here at the Tennessee Department of Health and the Office of Minority Health and Disparities Elimination to combat those factors, the social determinants of health and the historical context and those longstanding barriers that you mentioned in your presentations to eliminate those disparities and inequities. So thank you so much again. Next slide. And so for the Office of Minority Health and Disparities Elimination, we're really here within our agency to empower communities to support optimal health for all, or health equity, and eliminating health disparities for racial, ethnic, and underserved populations. And so we strive to provide that minority perspective for our commissioner and for the offices and divisions throughout our agency, as well as our stakeholders, to provide that minority perspective on those health issues that impact communities of color across the state of Tennessee. Here we have engaged with faith leaders, community leaders, our legislators, and healthcare providers to really provide insight into the health challenges that have been expressed this morning that our communities face, and to help to create innovative solutions around those challenges. And so with that, we serve to be that bridge and a resource to TDH programs for our stakeholders and for the residents of our communities to provide outreach as well. Next slide, please. And so here, moving into the COVID-19, our agency provides data on a daily basis, which is updated every afternoon at 2 p.m. that highlights the picture of health for Tennessee relative to COVID-19. And so what you see here is yesterday's numbers, where we've increased by 666 cases yesterday, 7 deaths, hospitalizations, and over 5,750 tests that were administered as of yesterday. Currently this morning, we actually, our office coordinated a COVID testing event that's happening right now over at the Northwest YMCA in North Nashville, where we're continually working to expand COVID testing for our African American and Hispanic communities. And I'll talk a little bit more about that later in the presentation as well. But I also, too, as it relates to these numbers, want to note that as it relates to, as you all may be seeing the rates of hospitalization start to increase again, that the hospitalization totals that you may see on our page are subject to a 24-hour delay as well. Next slide, please. And so we have been having so many conversations with stakeholders and legislators throughout this pandemic, and we receive a lot of questions related to the data and what that looks like for our African American community specifically.
She said,
and so we
the GPS told.
Okay, so we are in a process of developing a public-facing dashboard that will be helpful for our stakeholders and for legislators to be able to utilize to help create additional policies and to use to better serve your constituents and the residents that you're serving here in Tennessee. And so here, like I mentioned, this is a snapshot of the data. Now, this data is as of September the 30th. But here, as you can see, we have, as of September 30th, there were 196,139 COVID cases in Tennessee, a rate of 2,872 cases per 100,000 Tennesseans. Additionally, that is 18.17%, or 36,639 of those total COVID cases were reported for Black Tennesseans. That's also a rate of 3,061 cases per 100,000 for Black Tennesseans. And so, according to our estimates, that is 17.1% of our Tennessee population as Blacks. And so, in the left top quadrant of this slide here, we try to summarize the picture of Black cases. And so, you see, this is the total number of COVID-19 Black cases, our new Black cases for COVID-19, the total number of Black COVID-19 hospitalizations, as well as the total number of deaths. And then also in the italic, light blue italics, you will see where that compares to the overall group of cases, hospitalizations, and deaths. Also to the right, we have the rate of Black cases by zip code in Tennessee. Many of our stakeholders have been looking for more granular data besides the typical county and regional data that we typically release. And so in our attempts to be able to capture those needs of our stakeholders, this is where we are, and hopefully this will better serve our stakeholders to be able to, that will meet your needs for your outreach efforts. Also at the bottom, you'll see the Black case demographics, which is similar to what you typically see on our state page for our statistics, where we have the demographics broken down by age, sex, gender, hospitalizations, and then by the number of cases, deaths, and percentages. You'll also find that we've added a new column relative to the percentage of deaths as well. Next slide, please. And so here is rate comparisons looking at those regions. And here you'll find that in the top left quadrant, we have all races and ethnicities for case rate per 100,000 Tennesseans. In our right top quadrant, we have white cases rates per 100,000 for white Tennesseans. In the lower left quadrant, Black cases rates per 100,000 for Black Tennesseans, and then in the lower right for Hispanic cases per 100,000 Tennesseans. And as you can see here, from the regional perspective, where we typically have our highest population for Blacks here in Tennessee is in our West region. And so you'll see in that top left case rate quadrant, we see the highest rates for Blacks in that West region. For Hispanics, you'll see that you find the highest rates in the Chattanooga-Hamilton area. And then for whites, you'll see those highest rates in the upper Cumberland region. Next slide, please. And then this is a depiction similar to the race visualizations, but this is specific to our hospitalization rates. And it has the same layout in terms of all hospitalizations, those for whites, Blacks, and Hispanics. Next slide, please. And then here would be for mortality. And again, same format in terms of overall cases for mortality, white mortality, Black, and Hispanic. Next slide, please. So here is a different visualization of our statewide data, giving a comparison of Blacks, Hispanics, and white COVID rates. As you can see, for African Americans, we have 1.5 times higher rates than our white counterparts. For Hispanics, that's 3.2 times higher than our white counterparts. For hospitalizations, African Americans are 2.45 times higher than our white counterparts for hospitalizations, and Hispanics 2.59 times higher. Again, for mortality, as African Americans, we were 1.85 times higher in our mortality than our white counterparts, and for Hispanics, 1.23 times higher. Next slide, please. Here is, you'll see just the Black-white comparison of COVID-19 rates. And it's those same statistics that I was sharing in the previous slide, just giving you a comparison of just the Black-white as it relates to the rates. Next slide, please. And here you'll see the comparison for Hispanics compared to white COVID-19 rates. Next slide. So next, I kind of wanted to share with you our community engagement and outreach efforts. Since April, really, we have strived to work diligently to meet the needs of our community of color in terms of putting out, releasing messaging that will resonate with our communities, and so that they would know that we want to ensure that they have the appropriate resources and information that they can make the best decisions for them and their families relative to their health. As Kanika mentioned earlier, a lot of us African Americans are those essential workers that have been out here on the front lines throughout this pandemic. And so we want to make sure that we're continuously communicating the right messages and those best practices that they need to stay safe as we work to get through this together. And so with that being said, back in May, we had created and produced 5 major commercials that were released across all major networks here in Tennessee. We produced videos that spoke to the physical distancing without social distancing. We had a commercial that focused on pregnant women and being able to seek care during this time. We also had a commercial that spoke to the resources available across our communities, providing examples and linkages to our pages that spoke to the social services within a given area. what to expect if you have been exposed, what to expect if you tested negative, and several other resources. We also highlighted, again, those essential workers across Tennessee. We asked our partners to submit pictures of themselves and their families, their loved ones who were out there, whether they were bus drivers, who were those that were nurses. We received a great response relative to being able to see the faces of our loved ones out there doing the work necessary to help keep us safe. And then we also focused on the tests. There are many, many people that have been in fear and still fearful relative to COVID testing, and we wanted to bring some ease to what that process entailed. And so we created a commercial that talked about the access to testing and demonstrated what you would go through if you were to go to one of the pop-up or surge events that we've been doing across the state. We've also created a task force that we started back in April that has been taking place every single Thursday since then. And initially, this was to really just create, making sure that we were creating accurate and timely information relative to COVID safety, prevention, and disseminating those best practices and promoting access to testing. And since then, our task force has truly evolved to making sure that there are resources that are made available to our members relative to across all agencies, relative to disparities and those resources that will be beneficial to our communities of color across the state. Next slide, please. Some of the conversations that we were having throughout this time that has helped us in terms of how we have had to shift or pivot our messages and to be mindful and stay mindful of what those that we serve are seeing, hearing, and feeling themselves. And that has been really trying to share the message. Kanika said it best earlier when she mentioned how the myths that African Americans would not get COVID, and that, as we all know, is not true. COVID-19 does not discriminate, and it hasn't discriminated. And so just making sure that people know what that entails for their health. Many of us in the African American community have pre-existing conditions and other underlying conditions that are exacerbated as a result of COVID as well. And this is information that our communities need to be aware of and able to take the appropriate action to make sure that they're staying safe. Also, there has been a lot of effort to make sure that the resources that we're providing and the messaging speak to those that are on the front lines that feel that if they were to be tested and tested positive, that they couldn't afford to stay at home because of the period of time that's needed to quarantine. There's a lot of messaging that and just conversations that go into what can we do to make residents feel safe, protect themselves, and to protect others if that becomes the case for them. And again, just addressing the misinformation and conspiracy theories, debunking myths related to testing, as well as the fear of deportation from our Hispanic members, and just the mistrust of government as it relates to COVID-19, as it relates to vaccinations, and et cetera. Next slide, please. I mentioned earlier that we have been doing COVID testing since early May, And so since then, we have coordinated over 109 events. We've completed over 90 of those events and have tested 14,819 folks who've come out to be tested through these events. We started out in our metros and have expanded out into the rural counties across the state of Tennessee. As we know, when we think about a health outcomes, that no county in the state is the same. And so we have to make sure that we're able to accommodate and attend to the needs of that specific population for that particular area. And so we try to be mindful of that and accommodate to the degree as much as possible to make sure that the communities that we're going into, that they know that this is something that is safe and they know their status. So here's a depiction of those areas that we have been in so far. And again, we are here at the Northwest YMCA this morning as well. Next slide, please. So here I just wanted to highlight some of the visualizations that the CDC has offered as well relative to the risk of COVID-19 and hospitalizations. Here we show where chronic health conditions such as diabetes, increase your risk of being hospitalized from COVID-19. And so also too, you'll see other health conditions such as asthma, hypertension, obesity, kidney disease are depicted here, and your level of risk of getting COVID with those conditions. Next slide, please. And then here also too, we look at as you get older, your risk of being hospitalized or a risk of dying for COVID increases as well. So here's a depiction that highlights that those ages and your risk for hospitalization or death as a result of that. Next slide, please. And then here shows race and ethnicity and the risk markers of other underlying conditions that impact health, including your socioeconomic status, access to health care, and increased exposure to the virus due to your occupation. As we've talked about extensively, those frontline essential and critical infrastructure workers. Next slide, please. And so for these last couple of slides, I just want to talk about some of the next steps and things that we're doing here in the department. And so as we work to advance health equity, Kanika talked about racism, and racism is a public health issue. Many states, as you've seen across the country, have declared racism as a public health issue. And, you know, we consider racism as a public health issue, and we'll go as far as to say racism as a underlying condition as well. Here I highlighted the quote from Dr. Kamara Jones, who is truly someone that I look up to here in this public health field, and has been a trailblazer and leader across our nation relative to public health. Again, you know, we've always looked at addressing social determinants of health, but we haven't made a lot of headway as it relates to the underlying root causes of systemic and structural racism as we work to advance health equity. And so these are some of the things that we are building upon within our office. Next slide, please. And so as we think about achieving and advancing health equity, we are having many conversations. We're talking, we're teaching, we're training, and we're trying to take action. And so thinking about those things that that we have on the table right now. As I mentioned earlier, we're doing the weekly task force briefings every Thursday afternoon. We're having targeted communication on our websites, our social media, disseminating information and receiving information from our stakeholders and partners who we value so much. A lot of the work that we've been able to do throughout this year alone, we couldn't have done without the input of and the feedback of our stakeholders, and we appreciate you all so much. We developed sections where we can have anyone who comes to our page be able to submit questions and comments to further the work or to further your work as well. We are incorporating or developing health equity training internally for our internal workforce as well as for our external partners. We have recently had 5 listening sessions relative to vaccinations, and that is just hearing from those in the African American community, whether it was our students from our HBCUs, healthcare providers, faculty, our community-based organizations, and just other community members who we sat down with in the month of September to really get their perspective of their feedback from as African Americans to understand the historical perspective of vaccines and get their insight on to provide insight on access to vaccinations and the best way to communicate vaccine messaging across our minority communities. Also, we work very closely with our historically Black colleges and universities here in Tennessee. We provide funding to Meharry Medical College, to Lane College, to Fisk University, to Lemoyne-Owen, and to, did I forget somebody? To make sure that they have resources to equip their students as ambassadors to develop ways to provide prevention education to decrease the virus transmission on their campuses. We've also expanded our work relative to our partnership with Meharry Medical College and the HBCU Wellness Project to provide prevention education and outreach to educate and inform multicultural, multi-generational communities, including medically underserved, under-resourced populations about the impact of COVID-19 and how to mitigate the further spread of COVID-19. And several other activities that we're working with our students at the HBCUs to address COVID and other barriers to health disparities on their campuses and their surrounding communities. Also, we've instituted Lunch and Learns most recently. Kanika mentioned earlier about redlining. We had a conversation a few weeks ago about segregation in housing and redlining. And 2 weeks ago, we had a conversation about trauma in the Black community. This upcoming Tuesday, we're going to continue that conversation about trauma and talk about how trauma and workplace strategies to address mental health this upcoming Tuesday during the 12 to 1 o'clock hour during the lunch hour. So hopefully you all will be able to join us for that as well. So there's several things that we're working on, even strategically internally with our agency as a whole, to advance equity as it relates to access to care and other focus areas and objectives that speak to education, engagement, and policy change. And I will stop there. I think my next slide is just the last slide with my contact information.
Thank you so much, Monique. That was a really informative and data-rich presentation. Thank you for sharing that with us. So everyone can continue to put their questions for Monique in the chat box. We have a question though. Have you been able to look at this data for COVID by the person's uninsurance or lack of health insurance status. You're muted again, Monique.
Sorry, can you hear me still?
Yes.
Okay. Yes, so we have been working with our sister agencies and the Department of ECD, Economic Community Development, and others to try to look at the statistics relative to that. I don't have those numbers with me now, but if anyone is interested in those particular statistics, I'll be sure to provide that information for you.
Related, is the information that you presented here today available on the state website for your office?
Yes, so we have the our state office website as well as our agency site. A lot of the information that we post, we try to post to the main TDH COVID page, which I can place our link into the chat box, as well as our office website page. But yes, if there's any information that you don't see on our website that you would like to know, please reach out to me in my office, and we'll do our best to make sure that we can get that information for you.
Thank you, Monique. And so Tony Garr also wants to ask the same question that he asked to Kanika in terms of some states have looked at their budget and their policies through the lens of racism. And, you know, same question, has Tennessee been able to do this? And particularly, have any of the state legislators contacted you or your office to ask for a comment on budget items that are racist?
Well, I would say that I would say no at this time in terms of the state as a whole. I think that as we're continuing to have conversations with our legislators and our governor, that hopefully there will be more opportunities for us to incorporate this into the budget. I would say that for me specifically in the Office of Minority Health, we have been having conversations relative to that and trying to receive additional funds that will go even more directly than the state funds that we currently have specifically to minority communities.
Thank you so much for that answer, Monique, and thank you for posting the State Health Department website there. I think there are no more questions for you. So thank you again for that wonderful presentation and for joining us here today.